A continuación vamos a dar paso a la segunda exposición, los retornos de la inversión en política de salud mental adolescente, que está a cargo de Rachel Nugent, que es de RTI International. Es el Instituto de Investigación de Estados Unidos que desarrolla proyectos para la resolución de problemáticas globales. En los últimos años, RTI se ha dedicado a estudiar los casos para la inversión en salud mental adolescente en diferentes países. Estas investigaciones están destinadas a analizar, también a cuantificar el beneficio fiscal de los programas y de las políticas estatales de promoción y prevención en la materia. Rachel Nugent es vicepresidenta y directora del Centro para las Enfermedades No Transmisibles Globales en instituto, y tiene más de 30 años de experiencia en el desarrollo global como investigadora profesional y también como asesora de gobiernos en políticas públicas. Adelante, Rachel. Muchas gracias.
Gracias. Y muy buenos días. Gracias por la oportunidad de participar en este evento importante. I'm going to speak in English because otherwise I won't be able to say what I need to say. We have been working with UNICEF and also with PAHO for some years. My team at RTI works on non-communicable diseases, and mental health is now joined with non-communicable diseases in our understanding of how to address these conditions, how to try to meet the Sustainable Development Goal targets, and trying to understand a more comprehensive set of services for children, adolescents, and adults. So we have been working for some years on this adolescent mental health investment case, and I will tell you a little bit about what that is and what our results are. Let's see here. You're in the room because you know this is a very important issue. It's important for our families and our children. It's important for our societies. It's also important for our economies. And that's the part that I'm going to speak about here today. We know that mental challenges, mental disorders of different... Thank you.
It's okay.
Of different kinds affect young people in many different ways and across the entire globe. So it's a large problem experienced everywhere. We also know that many different kinds of mental disorders begin early in life, or maybe show up in late childhood or adolescence. And so it's important to, as we have been discussing here today, to focus on that age group and understand what are the signs, what are the opportunities for intervening. 50% of mental health disorders show up by the age of 14, 75% by the age of 24. So this is really a critical time period in people's lives. We also know that across the world, there's very low availability of services and programs. We've heard about some very nice ones today. There's more attention to this issue. But in beginning our analysis, we learned that there's shockingly low coverage of services that have been proven to have good results. So we know that scaling up and being able to achieve larger scale, national level programs and availability to young people is tremendously important. So the purpose of our investment case really was to conduct a global economic evaluation to quantify the return on investment. So this is a standard sort of economic financial term that we all, I think, understand. If we make an investment of a certain amount of resources, a certain amount of money, what will we get back? And of course, what we get back, importantly, is for health. We get better health, better well-being, better lives of our young people and our families, but we also get economic returns back. And so this is what we were trying to understand. And whoop, I keep going the wrong way. Here we go. Okay. So what is an investment case? It is an economic analysis where we look at what is the cost in monetary terms of the conditions that we're looking at, and what is the cost and the benefits of doing more. So we look at the cost of sometimes what's called inaction or status quo, and then we look at the economic value to be derived from increasing coverage of services or bringing in new programs. And that's what an investment case generally consists of. And there have been investment cases done for many different kinds of health issues around the world, in countries as well as globally. And it often is one of the first things that decision makers want to know when they're being asked to supply resources for new programming or new policies. Well, what is it going to cost me? And what will we get in return if we do this? So it has become a very pretty common thing for different areas of health to try to develop this understanding of the economics. So what we did was to develop this global investment case. It's not really global because it doesn't include all countries. It includes only 36 countries, but together they comprise 80% of the health burden of the conditions that we looked at. So large countries, naturally, with a lot of population and a lot of youth population that captured much of what we want to understand across the world. We looked at the needs for prevention and treatment for these 4 conditions. Of course, there are more conditions and more aspects to be looked at, but for capturing most of the health burden, we captured that with these 4 conditions: anxiety, depression, bipolar disorder, and suicide. Also, for many countries and many young people, disorder conduct is also a high burden, but we couldn't find sufficient evidence about disorder conduct except in high-income countries. So we left that off our list. We just didn't have enough to be able to analyze that. So these 4 conditions do comprise the vast majority of the health issues that are being experienced. So we estimated the economic impacts for adolescents aged 10 to 19 over the lifetime. So in addition to quantifying the health aspects of these different conditions, we looked at the impact on education and on income, because we know that health conditions that start early in life or even in young adulthood can affect people throughout their whole lifetime. Not all health conditions do have lifetime effects, but mental health certainly is one of those. And again, the premise being if we can address it early in life, we can improve people's entire life course. So there we go. This is what it looks like. The investment case that we published was in BMJ Global Health, published earlier this year. It's available free online. And there's a lot of technical aspects. It describes what I will tell you, but in much, much more detail. There's, I think, a 39-page technical appendix for those of you who really want to get into the details of the economic modeling and so on. But we used evidence from all of the good evidence that we could find from countries around the world. We especially were looking for evidence from low and middle income countries. But the way it is that a lot of the evidence of interventions and what is working comes from higher income countries. And all of the references and all of the intervention effects and costs and so on are all detailed in the paper. So I will tell you some of the high-level points here. Okay, so on the prevention side, we included these interventions, which had strong evidence of good effects in a range of populations. Universal prevention of anxiety and depression. This is in the school, so school-based intervention delivered by teachers. We've heard about some of those specific examples already from Andrea. Indicated prevention for depression. So for those young people where a screening indicates that they have high risk, then there's a targeted indicated prevention for them for depression. and then prevention of suicide in two different ways: in school, universal prevention in school, as well as a follow-up prevention for those who have self-harmed, that prevention taking place in the hospital. So that's on the prevention side. Keep doing that. On the treatment side, we have a range of interventions, some of which you've heard mentioned here. Treatment of anxiety and treatment of mild and moderate depression have the same interventions that we have applied, but with the different outcomes, looking at the outcomes for anxiety and the outcomes for mild and moderate depression. In-person cognitive behavioral therapy in groups, individual cognitive behavioral therapy delivered via the internet, and then also an internet-based guided self-help for both anxiety and for depression. Treatment of severe depression with medication and in-person CBT, and then also treatment of bipolar disorder in a family setting for adolescents, as well as with medication. And I want to mention that we have, every time, we have had the benefit of specialist guidance in developing our understanding of these interventions and our understanding of what to put into the investment case from both of the current and the former director for mental health at WHO OMS, and Shekhar Saxena, who was a former director at WHO for mental health, is a co-author on the paper, and we also consulted with a number of child psychiatrists and other global mental health experts. So my team is mostly economists and public policy specialists, but we got very good advice from experts on this. So here you can see the results broadly. So the top level, high level result is for every dollar invested in this full package of interventions, the return is $24 in health and economic benefits. The health benefits, of course, get measured as morbidity and mortality, so illness and death, premature death. And the economic benefits get measured as productivity impacts that are, let me start before that, impact on educational achievement, which has an influence on income, and that has an influence on people's working productivity. So we measure that whole sequence of impacts, and then in addition, we measure the intrinsic value of life. So, life is worth more than what we earn working, and that has an intrinsic value, and we quantify that value. So in terms of the reduction in disability and the reduction in premature mortality. So all of those things are included here. And I didn't mention, I think, also the direct saving from medical expenditures due to reduced burden of the mental disorders. So that's all included here. We find, of course, that we include cost-effective interventions, and the overall result is a very much higher economic benefit than the costs. And the highest ROIs occur in the low and lower middle-income countries. That's not to say that upper middle and high-income countries don't have good ROIs. They do. They also have very good ROIs. But in particular, in the lower and low middle-income countries, where the costs of delivering the services are really quite inexpensive. Some of those interventions can be delivered for 1 cent per adolescent, per person receiving the treatment. So the costs are lower. We also, I want to mention, in lower resource settings, often there are not very many specialists, mental health specialists, psychiatrists, and specialized providers. So we included some task shifting where lower level health personnel, or as well as, of course, the instructors in school, were delivering the interventions and being supervised and monitored by specialists where needed. So we were able to identify ways to lower the costs of delivering services in places where needed. So let me move to a few of the specific numbers. Here you can see for some of the interventions that were very, very having high return on investment. The universal prevention of anxiety and depression delivered in schools by teachers had a return of $147 per dollar spent on the program, so very high relative to just about anything that you'll find anywhere. And then the highest one was the in-person group cognitive behavioral therapy for treatment of mild and moderate depression. You can see that those numbers are, really extremely high. Why are there big differences? I mean, all of these are very good relative to just about anything that we see, for the reasons I gave at the beginning. Intervening early in life can have a big impact on the well-being across the entire life. And we included in our study a whole 80-year period, that is, getting all of those young people who experienced the intervention as young people. We included the impacts on their entire life, because the benefits endure, even though in our assumptions we did not have the intervention lasting beyond adolescence. So the benefits endure through the whole life, and some of them, of course, would probably need additional intervention as adults, but we didn't include that in this particular study. So there are reasons for those different ROIs across interventions, such as the effectiveness of the intervention, the cost of the intervention, and the way in which it's delivered. And then across countries, the costs vary depending on the wages, that is the costs for the different personnel who deliver the interventions. In some countries, it's much more expensive to deliver than others. I would say, too, about the in-person group CBT, one of the reasons that has a very high ROI is that it has a very beneficial impact on suicidality as well. So there is a lower suicide rate from those who have received that depression intervention for moderate and mild depression. So it's sort of a double benefit there. So where we're going next, what we're working on. I wanted to mention this. This is perhaps for the discussion, emerging areas for research. I won't go through each one of these. I'll just put them up here because you may be already in your work thinking about some of these things. These are things that we weren't able to include, but that are important to consider in terms of developing programs. So I wanted to mention those and hope maybe we will discuss some of them. But to wrap up on the investment case, what we're doing now is working in 5 different countries to develop country-level, national-level investment cases in Egypt, India, Indonesia, Mexico, and England, a range of countries, of course, there, each with their own context, each with their own adolescent health and well-being situations. And so we're working with specialists in each of those countries to understand what the needs are, what the level of services are, the availability and the types of services. And we're calculating not only the return on investment based on the local contexts, but the affordability of the interventions that are included in the package. And we're working also to disseminate and reach adolescents and other stakeholders to talk with them about what is most acceptable. So this is in the category of implementation research, including a range of the kinds of things we didn't do in the global case, but that are really important to think about when you're in any specific local or national situation, so that the results will be relevant to that situation and also implementable. So with that, I thank you.